Hello, everyone. Welcome to another review class for our practitioners from the Philippines. Today, we shall be discussing in detail a type of excess pulse, which is the tight pulse or Jin Mai. We will explore the characteristics and implications of the tight pulse in traditional medicine. Excess pulses, such as the tight pulse, play a critical role in traditional medicine by signaling underlying imbalances within the body. Recognizing these pulses allows practitioners to diagnose conditions accurately and tailor treatments effectively. Tight pulse or Chin Mai is a notable indicator that reflects a state of excess within the body. So it's an excess. Its firmness and pronounced strength suggest an underlying imbalance, often associated with stress or dietary excesses. What are the characteristics of the tight pulse? It exhibits a distinct firmness. It feels hard and taut to the touch, and this means there is excess energy state within the body. This pulse is characterized by its notable strength, so that means there is a vigorous flow of energy. It is often associated with excess heat or yang energy in TCM. A tight pulse is commonly linked to a rapid heartbeat. So this suggests heightened physiological activity, often related to stress or illness. This pulse can be palpated in different positions on the wrist, such as the radial artery, where its specific characteristics may vary slightly depending on the position. What are the causes of excess pulses? Emotional distress, strain from physical exertion, dietary factors, chronic health conditions. Okay. Now we proceed to the next one. We are going to wait. So far we have tackled 5 excess pulses, okay? And next week we shall continue with our large pulse. And after that, we will go back from the beginning. We need to know the basics, no? Tight pulse is one that arrives tight and forcefully. So tight like a stretched rope or twisted rope. It is almost vibrating. This indicates cold, pain, food retention. This is due to excessive pathogens struggling rigorously with the Zhang Qi, your upright Qi. This is also a hard pulse like the wiry pulse, but here in tight pulse, it is wider and less springy, no? No, springy, just like the violin that's wiry. It feels like a rope that has been twisted and tightened, such as a tightrope. This is seen when there is cold. The cold can be both exterior or interior. The depth of the pulse will be decisive. The tight pulse can also be experienced when your patient is in pain. So patterns of imbalance, cold and pain. So if the pulse is tight but slow, it's cold. Make sense? If it is tight and superficial, so that means there's exterior. That's invasion of wind cold. Remember, it's tight. Tight and deep, so it's very internal. Internal, excess cold. If it's tight and slippery, cold, phlegm cold, or phlegm cold and phlegm stagnation. The pulse rises and falls with strength and vibrates to the left and right. Okay? It's like fingers on a tightly stretched and twisted cord snapping back and forth. So it's tense and taut, forceful, vibrating. So it's very unstable and movable. So what are the indications? So there are 3 etiologies: cold pattern, food stagnation, and pain. So why cold pattern? Because if the patient has a lot of cold, it causes contraction. So it makes the vessels contract, and so the pulse becomes tight. So food stagnation. Cold accumulates in the middle burner, and this causes food stagnation. If there is food stagnation, this obstructs the movement of qi. Pain. When there is pain, there is obstruction. Obstruction causes the vessel to spasm and feel tight. So, in biomedicine, this can be caused by vasotonic increase, blood volume increase, or increase in cardiac stroke volume. So, a pulse which rises and falls with strength and vibrates to the left and right is called a tight pulse. Okay? So, a tight pulse, which is rapid and strong, this is caused by perverse cold chi, which can also be caused when perverse cold chi blocks yang heat. Whenever diseases are caused by attacks of perverse cold, when abdominal pain is caused by chi blood stagnation, or when body pain is caused by tightening of the channels, there may be a tight pulse. So we should not confuse the tight pulse with wiry and full. The full pulse has big, long, wiry, strong beats, and full means you can feel it both superficially and deeply. The wiry pulse feels taut, long, and strong, passing straight under the fingers without vibrating to the left and right or giving any wave-like sensations, and it is springy. No? Clinical significance: excessive cold, perverse chi, which causes any type of pain, gives a tight pulse. Perverse cold chi, which attacks the lungs, okay, this can cause coughing and asthma. It gives a tight pulse. Okay, so if you have a patient who had an asthma attack or is coughing because he was exposed to a very cold environment and who happens to have a very, very weak zhang qi or upright qi, then expect a tight pulse. Perverse cold qi attacking the liver and accumulating, causing wind epilepsy, gives a tight pulse. Perverse cold qi which attacks the spleen, which causes vomiting of cold phlegm, that's also a tight pulse. In a disease of external perverse cold chi with a floating tight pulse, treat with pungent warming herbs so that you can scatter the perverse cold. In a disease of internal perverse cold with a deep and tight pulse, use pungent hot herbs to warm and scatter the internal cold. This explains the therapeutic principles for the treatment of perverse cold chi. Now let's go to the pulse positions. The right and left Sun positions, that means your heart and the lungs, are different. The left is called Ran Ying, and the right is called Qi Ku. External perverse cold attacks produce a tight pulse at the left Sun position. Internal perverse cold injuries, they produce a tight pulse at the right Sun position. In a disease where cold dampness accumulates and blocks the middle heater, the stomach and spleen causing abdominal pain. So you expect both the right and left quan to be tight. Okay? And in a disease where excessive perverse cold in the lower heater causes in cold symptoms, sensations of chi rising from the lower abdomen or hernia pain, both positions can be tight. Okay, let's go now to assessment. Mom Trix, are you ready? Mom Trix?
Okay. Hi. Yes.
Thank you. Let's welcome Mom Trix of Sampaloc, Manila. Seasonal changes that influence the pulse quality. Actually, what is being asked here, what do you expect the pulse quality to be when it's summer, spring, autumn, winter?
Adventure.
Spring, okay.
First, yes. First spring, the pulse would be wiry.
Okay.
And then for summer, it's flooding. Autumn is floating, and winter is should be deep.
So these are all normal, no? Okay, what about geography and environment? Like, what happens to the pulse when you go to moist and warm regions, then dry and cold? Di ba usually pag moist tends to be warm
Yes.
and
Yes.
humid, di ba? Then we have the dry
Mhm.
and cold. Okay.
For moist and warm regions, uh, we should feel the pulse to be soggy and slightly rapid.
Yeah, because of
And
the
then, yes. And then for the dry and cold regions, we should feel it deep and forceful.
yes. Thank you. Very good. What about gender? Is there a difference? Let's talk about the female. Of course,
Yes.
in contrast to the male.
For female, the pulse is, well, it's weaker and thinner, and then it's slightly more rapid than the male pulse.
Okay. Weaker, thinner,
And slightly
slightly
more rapid.
rapid. Okay. What about age?
For age, the chi and blood for the elderly,
Mhm.
um, it's weak and deficient, which can make the pulse it's feel empty and forceless.
Okay.
And then for the
Mhm.
younger, uh, the chi and blood is full and exuberant, and it will arrive in full force.
So, in other words, the younger the patient, the stronger the pulse, but the
Mhm.
more exuberant, no? While if the
More
patient is a little bit on, elderly, can be weak and deficient.
efficient.
Okay, what is a deviated angle pulse? Now, we should remember that not all will have the same location of the radial pulse. We have such thing as, so what does it mean when you say deviated angle pulse?
It means that the radial artery isn't found where it is expected to be.
Yes. So do not panic if you don't feel any pulse using the usual locations, no? Okay, with regards to diet, how does the diet affect the pulse?
So if one eats spicy, of course, the pulse would become slightly more rapid because of the heat.
And what about
And
like
then also the
alcohol?
alcohol, it makes it more rapid and forceful.
So between alcohol and spicy foods, alcohol will have a bigger impact, a stronger impact, no?
Forceful. Yes.
Okay.
Mhm.
Now let's talk about the change in width when you have yang hyperactivity or too much yang in the body.
Uh, for hyperactivity of yang, excessive heat in the body, which raises and moves the chi and blood to expand the blood vessels. And then the hyperactivity of yang due to yin deficiency. It's the outward floating of yang due to the depleted yin failing to control the yang.
Okay, so if the yang is hyperactive, you might want to consider looking at yin deficiency. Because if the patient has yin deficiency, it cannot control the yang. And so what happens here is the yang will be floating outward because the depleted yin cannot control it. Okay? What is a normal? Can you describe a normal or healthy pulse?
Normal healthy pulse, it shouldn't skip beats, and it maintains a constant rate, even rate, and can be felt at all three depths.
Okay, did you try checking your pulse on all three levels? Do you find your pulse on all three levels? If not, then it's not a healthy pulse.
Yeah.
Okay, let's go to TCM qualities related to the pulse rhythm. So we're talking about three types of rhythm. What are they?
We have hurried, knotted, and intermittent.
Yes, on and off. Hurried,
Um,
knotted, and intermittent. And the last one, what about TCM qualities related to the pulse rate? Very easy question.
Also, it's slow and rapid.
Yeah. Thank you so much, Mom Tricks.
Thank you, Doc.
Thank you. Thank you, everyone, for joining.